Hello and welcome. We're going to dive into a topic that, for so many families, is just incredibly heavy. We're talking about the journey of trying to understand a child's potential neurological condition. It's a path that can feel really lonely and confusing, but our goal today is simple: to help turn that concern into some real clarity.
And this quote, wow, it just gets right to the heart of it, doesn't it? If you're here, there's a good chance this is exactly how you're feeling. It's so much more than just medical questions. It's this huge weight of not knowing. And the first thing I want you to hear is that feeling this way is completely 100% normal.
So let's just start there by acknowledging that heavy burden. Because before you get any answers, there's often this long period of just deep concern. You're seeing signs, you're not sure what they mean, and that part of the journey is all about just grappling with that worry. You are so not alone in this.
But here's something that is so important to hold on to. This whole process, seeking answers, it isn't about just chasing down a label. It's about finding a roadmap. It's about moving from that place of feeling stuck and uncertain to a place of empowerment, not just for your child, but for everyone who loves them.
Okay, so let's shift gears a little bit. We've talked about the emotional side, which is huge, but now let's get into the information. Because honestly, understanding the terms is one of the best ways to reduce the fear. So what do we even mean when we say genetic neurological disorders?
You know, when you break it all down, it's actually pretty straightforward. These are conditions that start with our body's own building blocks, our genes. A change in those genes, whether it's inherited or just happens spontaneously, ends up affecting the nervous system, and that can impact everything from development and movement to how we think and learn.
Now I know, these names might look totally unfamiliar, maybe even a little intimidating, but seeing them helps make this abstract idea a little more real. These are just a handful of examples, and they cover a wide range, from conditions that primarily affect movement, like Rett syndrome, to even certain types of epilepsy that have a genetic cause.
So now that we have a basic idea of what we're talking about, the next big question is, what do you actually look for? What are those practical, real-world clues that might make you think, okay, maybe it's time to get a professional evaluation?
Yeah, this is the question. This is the one that I think keeps so many parents up at night, right? And it's not about becoming a medical expert overnight. It's just about learning to recognize some of the patterns that might need a closer look.
So here's what we're talking about. It's all about the patterns. Is your child not hitting those key milestones, or, and this is a big one, are they actually losing skills they once had? That's what we call regression. Maybe their muscle tone feels off, unusually floppy or really stiff. Or there are seizures, but without an obvious trigger like a high fever. These things, especially if you see a few of them together or if there's a family history, are really important clues.
And really, the biggest takeaway here is this: trust your gut. As a parent, you have instincts that are so powerful. If you're seeing these kinds of consistent patterns, especially a delay or, again, that loss of skills, that's your cue. Seeking an evaluation isn't overreacting. It's a proactive, loving step to take.
Okay, so you've made the decision to seek an evaluation. I get it. That step alone can feel huge. The whole thing can sound like this massive, intimidating process. But let's try to reframe it. Think of it more like a clear, structured path, just a series of manageable steps that are all designed to find you some answers.
So let's totally demystify this. What can you actually expect? What does this journey look like? From that very first appointment to hopefully a clear diagnosis. Knowing the steps can take away a whole lot of the anxiety. All right, here it is, broken down. It really starts with a conversation, a deep dive into your child's health and your family's medical history. After that comes a physical exam to check on their development. Then, if the doctor thinks it's needed, they'll recommend genetic testing. And that's not just one thing. It could be a small test looking at a few specific genes or a much broader look. But, and this is so important, it's not just about getting a lab result back. It's about having experts like genetic counselors explain what it all means, and then working with you to build a real long-term plan for support. Of course, the second I say genetic testing, I know exactly what question comes to mind for every single parent. Is this going to hurt my child? Is this going to be difficult or risky for them?
And thankfully, the answer is so reassuring. The vast majority of these tests are not scary, invasive procedures. Seriously. We're usually talking about a simple blood draw, collecting some saliva, or just a gentle swab on the inside of the cheek. It's a tiny, brief moment that has the potential to provide a lifetime of answers.
So, this all leads to the big question. Why? Why go through all of this? At the end of this path, what is the real, tangible benefit for you and your family?
It all comes down to this. Knowing gives you power.
It finally puts a name to what's happening, and that ends the agonizing guesswork. It helps point you towards specific therapies or ways to manage symptoms. It can give you clear information if you're thinking about having more children. And maybe most importantly, it opens up a whole new world of targeted care and connects you with support communities of people who just get it.
And that brings us to what I think is the most important part of this whole conversation. What happens after you get an answer? It is so critical to see a diagnosis not as a scary final word, but as day one of a new, better guided journey.
I mean, just look at this. This comparison says it all, doesn't it? On the left, that's the reality of not knowing. It's all confusion, worry, and dead ends. But look at the right. That's what a diagnosis brings. It's a total transformation, from confusion to clarity, from isolation to support, and from that heavy emotional weight to true empowerment. It gives you a path forward.
But let's be real. This all boils down to the biggest question of all, the one that's really about hope. After everything, can anything actually be done? Are there treatments for these conditions?
And the answer is yes. For some of these conditions, amazing new targeted therapies are becoming available. But even when there isn't a cure, that diagnosis is still one of the most valuable tools you can have. It creates that roadmap we talked about, a plan for supportive care, for therapies, for school, for resources, everything you need to help your child truly thrive and live their very best life.
And we're going to end on this thought, because it reminds us what this is really all about. This isn't just abstract science or medical jargon. It's about people. It's about very real families who need and deserve guidance, support, and a clear path forward on what can be one of life's most challenging journeys. Thank you so much for joining me.